Hello students, today we are going to discuss about the new chapters, that is head and neck, and myself I am Dr. Mahesh Choudhary, Professor of Surgery, Magad Medical College, Gaya, and today is my first class to you, and that is the introductory class that I am going to take the head and neck. The head and neck, diseases of head and neck and injury of the head and neck. You must know that I first come to the introduction. Here in the introduction we should take that head is the very important part of our body and control whole of our body, and it is of great importance and control the whole of our systems, and it contains the very important vital organs, that is the brain, and the nature has provided so much protection to our brain that it is protected under the skull box, and it is in great protection. The nature has provided very dual protection against the trauma and other things, and so the head injury takes place and protection also takes place due to the stuff and body parts. So we should first we will discuss about the injury of the head, that trauma of the head. All about, I think, in the world about 3 or 4 or 5%, or even you can say 4 or 5% of all the emergency admission in the casualties are due to the injury of the head. And not only this, about 1 lakh, that means even 50,000 of the children is also suffer from head injury per year, and among the children admission emergency admission in trauma, about 10% are of head injury, and so it is of great importance, and you should know each and everything about the head injury. If this is about the epidemiology, that is about the 4.5% of all of the emergency admitted in our casualty is of head injury. Head injury, that means they includes the injury of the skull. This head contains, that is structurally you can say injury of the skull, injury of the skull, intracranial hematoma, and injury of the brain. First you come to the injury of the skull. The skull is the outer covering of our skull, and it is also made up of protection purposes. And not only this, a skull, that its name suggests, it is having 5 letters, that is S-C-A-L-E. So it is better to know the layers of the skull. There are 5 layers in the skull. First layer is the skin, not the skull. That is the first layer of the skull, is a skin, which has its own importance, and it is different from the skin of our other parts of the body. The scalp skin, that having so many abundant sebaceous and sebaceous glands on the scalp, and for this purpose the most common site for the sebaceous cyst is the scalp. You are sometimes asked about the commonest site of sebaceous cyst. The first commonest site is the scalp, because its skin contains so many sebaceous glands in the layer, and so the most common cause or most common site of sebaceous cyst is the scalp. The second most common site of the sebaceous cyst is the scrotum. This skin is having so many hair follicles, and for that purpose our head is covered of tuft of hairs, and very thick hairs are there in our skin of the skull. The second layer is the connective tissue, that is very tough tissue, and it is closely adherent to the skin of the skull, and this connective tissue is also had clearly from the other part of the body, and it is very tough structures, and the blood vessels and others, it communicate between the skin, it adherent to the skin and the accommodata gallia. The third layer of the skull is the gallia accommodatica, that is the tendinous, or you can say the tendinous sheath of the frontalis muscles and the occipitalis muscles. It is a very tough layer of the skull, and it communicates, it attached with the connective tissue, and all these three layers, the skin, connective tissues layers, and the gallia accommodatica, all three are act as a single layer. When any injury, blunt injury or the sharp injury takes place, all these three layers act as a one, and all are because they are adherent to each other so closely. But one thing also you should note in the connective tissues, it is tough structures and blood vessels runs in the skull, very rich blood supply to the skull. For that purpose, any injury in the skull that cause profuse bleeding, and why it is profuse bleeding? Due to the fact that the blood vessels in the connective tissue that is adherent, that is severed end or severed part of the blood vessels remain attached to the connective tissue, and this connective tissue prevents the contraction. The protective mechanism for the coagulation of the blood is prevented by the connective tissue because it adherents the severe blood vessels very firmly, and so the cut wound or the severe wound of the blood vessels remain open and cause severe and torrential bleeding in the skull injury. The accommodata gallica is another third layer, that the tendinous insertion, anteriorly it is adherent to the frontalis muscles, and posteriorly it is the tendinous insertions of the occipitalis muscles. Not only this, it is adherent to the zygomatic arch on the lateral sides, and posteriorly it is attached to the occipital bone, that is the key of the occipital bones. So it closes from all the sides of the skull. Third layer is the loose, fourth layer is the loose areolar tissue. This loose areolar tissue is having separate, that is the not so tough, and it is under the accommodata gallia, and it contains so many emissary veins. It is of dangerous area of the skull because this loose areolar tissue layer containing the emissary vein that connects the facial veins and the veins of the exterior to the intracranial veins or intracranial sinuses. And this loose areolar tissue that is the dangerous area of the skull, because any infection takes place in the facial area or in the skull that can migrate through the emissary vein which remain in the loose areolar tissue and can transgress into the intracranial sinuses and cause fatal infection into the brain also. The pericranial, one thing also, this areolar tissue, as it is the potential space, and when any infection takes place in the loose areolar tissue, the whole of the vault of the skull, and you can say the whole of the skull under the pus transgress in this loose areolar tissue. Anteriorly it is limited by the root of the nose, and laterally by the zygomatic arch attachment, and posteriorly on the occipital regions. And so whole of this space is full of pus or the hematoma if infection takes place. So this loose areolar tissue layer is also great importance, and you must know about the transgression of infection from the extracranial to the intracranial side. The last is the cranium, that is the tough structures just like the periosteum of the bone, but it is loosely attached to the skull and but at the suture line it is adherent very firmly. So these are the surgical anatomy, and you should know the layers of the skull, that is the 5 layers. Skin has its own peculiarity, that is having so many sebaceous cysts and sebaceous glands, and for that purpose the sebaceous cyst is very common at the skull. Second is the connective tissue that holds the blood vessel firmly, and even after severing of the blood vessels, the torrential, the cut in of the blood vessels refused to contract, and that caused torrential hemorrhage even after the trivial injury of the skull. Third, there is the apneuritica gallica, that is the tough structures and cover whole of the skull, and underneath the loose area of tissue is there that give having the EC joint connecting vein from the extracranial to the intracranial area. The last one is the pericranium, that is the tough structure covering the skull. So these are the layers. Now a skull injury, how it takes place. The injury of the skull you should know, because the any injury takes place in the head, first the skull is affected, and etiological factors are so many, that is the road traffic accident, that is fall from the height, homicidal injury, or the any suicidal injury can cause a rupture of the or injury of the skull. And I have already told that in 3 layers, the 3 layers of skin, connective tissue and apneuritica gallica all together acts as a single layer, and so any injury takes place on the skull, all 3 layers get apart from each other, and due to the facts that any homicidal, suicidal, or fall from the height, road traffic accidents, these are the etiological factors of the skull injury or fall itself. Tibial trauma even in the old age, that also cause injury of the skull. The clinical feature of the skull injury is very obvious, and you can diagnose just after the trauma or just after the road traffic accident, that even the trivial injury of the skull can cause torrential hemorrhage due to the refusal of the contraction of the severe vessels, and that cause severe bleeding, and patient may go into the shock if it is not controlled properly, and then whole of the face, even for that purpose, even the trivial injury looks very severe. In case of the scalp injury, due to the whole of the face is washed with blood, but then you will examine it properly, and you will find it that all the 3 layers, that is the skin, connective tissue, apneuritica gallica, all together get teared and cause bleeding at the side. And so sometimes can injury of the scalp without any tearing of the scalp and cause hematoma under this, and it cause ecchymosis. Sometimes it happens so the avulsion of the scalp, that is the rotating injury takes place, like suppose if the hairs of the long hairs is a manhandle, or in others machinery injury that cause avulsion of the whole of the scalp and cause if all these 3 layers is completely avulsed from the loose area tissue, and we can see the pericranium in this condition. The avulsed scalp is only adherent to a small pedicles, but due to the very rich blood supply to the area or scalp, that the healing process is very fast, and this is very characteristic of the scalp injury, although it looks very fearful and very dangerous. in looking, but when you will treat the scalp injury in the better way, the treatment and the recovery is very fantastic and dramatic. And so you can diagnose it properly, and when you will examine with palpation that only the scalp has get injured, you must know also underneath the structures that the skull should also be palpated, and in trivial injury, skull is not broken, then this is purely the skull injury, but it may be associated with the also fracture of the skull bone, that is the flat bone, and then it becomes very dangerous. So it became open fractures, so it should be treated very precautiously. We will deal it, we will discuss in my other class about the scalp injury with fracture of the skull bone. Now come to the treatment. How we will treat the scalp injury? The scalp injury treatment is very easy to treat. That as soon as you receive the patient, you find out whether patient is bleeding or not. If patient is bleeding, find out the blood pressure report, and then you try to stop the bleeding, and then you transfer the patient in the operation theaters and examine the patient properly, and try to cease the bleeding, and it can be stopped either by pressure or just you put the gallia fluid, cartier part of the gallia fluid holding on the both sides of margins, and then invert it, and then pressure will cause a stopping of the bleeding. Then after a stoppage of the bleeding, you just wash the area completely, and the saving, that is the wall, that the scalp is full of thick hair, so it should be saved properly, and margins of the cut wound should be saved properly so that infection should not take place. And after saving, if required debridement should be done. That is the dead tissues of the scalp wound should be excised completely, and the regeneration takes place very fast in case of the scalp, because the scalp is evidently having blood supply, and so the healing process will take place in a dramatic way. And then after cleaning and debridement, you stitch the wound in two layers, that is the gallia to gallia, that is gallia, here part of the gallia should be approximated with the clear part of the margins of the gallia on the other side, and then intricate sutures should be done, and the second layer of the suture should be done by non-absorbable suture, that is the silk or the threads or nylon, and then you clean the wound, and then dressing should be done, antibiotics should be given properly. You should also measure the blood pressure, and if required, you can give also the blood transfusion or the IV fluid to maintain the hypovolumic shock. And so in this way, you can treat the scalp wound very nicely and very successfully. Another thing, sometimes there is avulsion of the whole of the scalp, and you will be surprised to know even when the whole of the scalp is avulsed and attached with only a pedicle, if you will clean it properly, if you will debride it completely, and then reposition of the avulsed scalp, that stitch in proper way, that will take place and that will heal very fast, even within a week. And in this way, the avulsion whole of the scalp can be treated also very successfully. So these are about the scalp injury. Now, before going to proceed in further, we should also know, in case of the head diseases or head injury, intracranial pressure should also know properly. What is intracranial pressure? That is ICP. That ICP is the pressure exerted into the subarachnoid space. The brain is having 3 layers of dura, pia and arachnoid meters. In the subarachnoid space there is a fluid-like structure, clear fluid, that is called spinal fluids, and this fluid this circulates in the whole of the part of the brain and even also the spinal cord. That is CSF, cerebrospinal fluid. And this cerebrospinal fluid exerts a pressure inside, and this is called intracranial pressure. Intracranial pressure in our skull, that is in the brain, is 10 to 15 mm of Hg. That this pressure also this intracranial pressure also acts as a buffer-like action and prevents the brain from the injury or trauma. That intracranial pressure sometimes is increased, then becomes a problem, because intracranial pressure that give the perfusion of the brain tissue. Due to this intracranial pressure only, the perfusion of the brain tissue takes place, because brain tissue is very vulnerable and it requires very much oxygen for its functioning well, and most of the energy is liberated by blood glucose, and 90% of the energy is received by the blood glucose into the brain tissues. And so the perfusion pressure is exerted by the intracranial pressure. The perfusion pressure is the difference of the systolic blood pressure minus the intracranial pressure. That is, the systolic blood pressure is 120 in the normal persons, and intracranial pressure is 10 to 15 millimeter of Hg. And so the differences between the two, more or less 100 mm of Hg, and this 100 mm of Hg produce and give the perfusion and blood supply to the brain, and brain is dependent for its energy from the blood glucose, and from also oxygen takes place from the circulating cerebral blood vessels. So what are these? This intracranial pressure makes an equilibrium between the brain tissues and also the intracranial space. And when intracranial pressure rises, due to some cerebral edema or due to the space occupied region in the brain that cause obstruction in the circulation of the CSF, that is cerebrospinal fluids, and then the pressures of the cerebrospinal fluids. When there is obstruction, its intracranial pressure rises, and when intracranial pressure rises, then there is herniations of the brain and also herniation of the ankles and other structures. There is severe, part of the clinical feature when intracranial pressure rises. Conditions in which the intracranial pressure rises is the subdural hematoma, extradural hematoma, space occupied lesion, brain tumor. These are the etiological factors for increased intracranial pressure. The clinical feature, how you will know about the intracranial pressure. The clinical feature, the severe headache will be there, vomiting will be there, amnesia will be there. Sometimes there is loss of consciousness, and in severe cases, maybe due to the severe cases, the convulsion will be there and patient may become unconscious. The treatment of the increased intracranial pressure is that you treat the cause, and then when cause is treated properly, the intracranial pressure without patient will recover from all the signs and symptoms. The headache will subside, vomiting will be stopped, patient feel better, and amnesia will be diminished. So the intracranial pressure is, you should know each and everything when you are going to study the diseases of the head and diseases of the brain and brain injury. So I have given just introduction about the intracranial pressure. Now come to the investigation in case of the head injury or in case of the disease of the head. Just you take the X-ray of the skull. X-ray of the skull can, if there is trauma of the skull, you should take the X-ray and X-ray of the skull in AP and lateral, and also take the oblique view. The stellate fracture or the fracture of the skull can be diagnosed just by the X-ray of the skull, and linear fracture can be seen in case of the trauma of the skull. Then you should also do X-ray of the spine. The X-ray of the spine will also tell the trauma, that is the fracture of the vertebral body or fracture even the spines of the vertebra can be diagnosed by this X-ray of the spine. The most important is the CT scan of the brain that will tell about even the fractures of the all facial muscles and bones, and also about the brain, and also about the skull. The another, it will tell about the space occupying lesion, the size, shape, and also the extent of the space occupying lesion. You can diagnose it by the CT scan. The another investigation is the MRI, that is the magnetic resonance, and it can be done, and it is better and very precise indication for the disease of the vertebra, bone, and the brain. The another investigation is the angiography, that is you put a dye into the circulation, and then putting the dye into the circulation, you take the X-ray and you find out is there any aneurysm or correction or constrictions of the blood vessels. The radioisotopes is the another new investigation by which the radio opaque isotopes is given into the blood, that will get circulated on the whole of the body and get concentrated at the site, and you can find out the pathological sites by the radioisotopes. So I dealt with today all these conditions by which you can understand about the head, disease of the head and injury of the head. In my next class, we will discuss about the brain injury or the skull injury. So just I would like to summarize whole of this session, that is you should know about the head injury about the whole of the 4 to 5% or 4.5% of whole of the accidental admission into the casualty is due to the head injury, and also injury. This head injury includes the injury of the skull, injury of the scalp, injury intracranial hematoma, injury of the brain. The surgical anatomy I have already mentioned 5 layers, and a scalp injury, how do you manage? Intracranial pressure, you should know about intracranial pressure so that the etiology or the pathophysiology can understand the injury of the brain. Investigation should be done. All these investigations, X-ray of the skull, X-ray of the spine, CT scan, MRI, angiography, and radioisotope. So this is all about today. Thank you. कितना होमवर्क